WIC is a supplemental nutrition program. So we do nutrition counseling and then supplemental food, which gets loaded onto an EBT card. And then they get breastfeeding support, and we also do referrals. So whether it's a referral within the health department or in the community, just making sure that they're all set up for what they might need for themselves and for their family. WIC is for anyone who is pregnant, breastfeeding, or postpartum, infants, and then children up to age 5.
No matter if they are with the parents, and no matter if they're with the dad only or the mom only, or the grandparents or a foster dad can also qualify for the child. WIC is a program that gives you everything. It gives you not only for those times that your family might not have food, but the counseling, the interaction, the support.
It's a head start for children and moms, and moms who were at one point pregnant and maybe are not anymore also, and they don't know that there's a lot of help out there for them.
And so we ask the background of like what foods they're having, like what beverages, any medical backgrounds, and then kind of go from what they need on that individual level for a health goal or a nutrition goal. Setting up food packages, so what fits best for them and like what their children need as well.
With that good nutrition, we're also able to kind of assess where they are like developmentally, emotionally, so it impacts so many different factors.
I actually breastfed 4 years, so I saw the difference between my children who I breastfed longer and who I didn't. So it just gives them that extra boost and those extra immunity and just vitamins. So obviously a lot of moms feel bad that they can't, and we have help for that too. We have formula. A lot of our community is bilingual. A lot of them right now, they're coming from other countries. They've never set foot here. They don't understand anything, like not even the basic information. So it's very important to talk to them in their language.
When you have a person from that same background, it's a little bit easier to kind of fit in those puzzle pieces, not only on a cultural level, but also on a culinary level. And because you know what it's going to taste like, it's a little bit more familiar to the client and to the nutrition professional to help make those connections a little bit easier for them. We offer different language services, so along with Spanish, Arabic, we also have a language line. So if someone comes in that just speaks a different language, we have the resources available for them to feel more connected to the services.
So it is important for them to know that WIC is for everyone, and everyone is welcome. And we are always willing to answer their questions or guide them. So it is important when they are in our clinic and they feel that someone speaks their language. They feel more comfortable to open up and start sharing how they feel.
WIC is for the community, and just come and ask. A lot of people are afraid to even ask, and so they can't get what they need if they don't even start it.
I feel like there is so much shame and stigma around needing help, and the stories I hear of like the clients who are afraid to ask for help at the store because they don't want to say they're on WIC. And that is what I wish people could understand, is there's no judgment. We all need a little help sometimes. And if that's what it takes to kind of get you through a rough period, that's okay. It's not something to be ashamed of. It's a tool that we use. It's a stepping stone. You're not on it forever. I feel like we have clients who will call to follow up with them, and they're like, you know what, things have kind of changed. We no longer need this service.